Hey, I'm Dr. Joe Niamp to LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. Today we're going to talk about the surgeon part. If you follow my YouTube channel, and I hope you do, we have almost 24 million views at this point. And if you follow my channel, you know that one of the things that I specialize in is endoscopic removal of forehead osteomas. These are benign bumps, bony bumps that people get on their forehead. And a lot of people take them off by making a big incision and pulling the scalp down. I do this with a small buttonhole incision, insert a scope like orthopedic surgeons use for knees and shoulders, and I reduce that bump or those bumps endoscopically. I've got a lot of videos out there, and the incision is masqueraded by the hair, and it heals great. So what's special about this video? It's probably the biggest osteoma that I have done. These can vary in size from a size of a pea, and this one's almost the size of a ping pong ball, and it's very dense bone. So we were able to make a single incision in the hairline, put the camera in, visualize the osteoma, which you're going to see all this in a second, and reduce it with various instruments so it's flat, and then we interview the patient the next day. So sit back and enjoy the video, and thank you for the greatest gift of all, which is your time. I'm Dr. Joe Niamp to LoveThatFace.com. And we're sitting here with one of our patients who just came up from Florida to have this very large osteoma treated, and we're going to do that tomorrow morning. And I'm honored that you came so far to get this done. We do a lot of these, but almost everybody we do is from out of town. I think I did everybody in Virginia that had an osteoma already. So how long have you had this?
Roughly about 10 years.
Mm-hmm. And does it bother you?
Not every day, but some days, yes.
Okay. Does it hurt?
Nope.
Okay. More of a social thing?
Absolutely.
People stare at it when they're talking to you?
They stare. What happened?
Yeah.
Did you hit your head?
Yeah.
You know.
Some of the people that I've done, that's the big thing. They said that they're just always having to explain, you know, what it is. They don't really care that it's there, but everybody asks them. Now, see the Harley patch there, you're an avid motorcycle rider. What's it like getting a helmet on over that?
Time to time, it's annoying. You know it's there. It pushes up against agitating. So, yeah.
I recently did a patient that was an equestrian. She rode horses, and she had a helmet that she had to wear, and it really hurt. It was pressing on there. So, this is a benign osteoma. We've looked at a CT scan, which we'll show you on this video. And tomorrow, what we're going to do is we're going to make, you zoomed in there, Hannah? We're going to make a couple buttonhole incisions, and we're going to put the scope in there and reduce this endoscopically without having to do any big incision there. And he should do fine. After this, really, it's not too bad. Some people have a little bit of headache, some people bruise a little bit, but I've never seen one grow back, and I've never had anybody unhappy with it. And how'd you find us?
I did some research, believe it or not, YouTube, and I found you guys, and for the last 4 years, I've been watching your videos. And,
I apologize.
Finally, I'm like, you know what? This is the guy I need to go see. So here we are today.
Well, it's my honor. We're going to go do this, and we'll check in with you post-operatively and let you know how it went. So this is the osteoma, and you can see how large it is, like about half the size of a ping pong ball. And now we made an incision in the hairline, and we're dissecting the skin off of the frontal bone, and now we're putting the camera in to look at the osteoma, and now you're going to see what we see on the monitor. So this is really kind of very pretty in terms of nature. It looks like about half of a ping pong ball or cue ball, and we use different types of instruments. This is a osteotome to help reduce it, and on some of these osteomas, they'll come off as one piece, and others are very dense bone, and you can take them off in layers, as shown here. Then we're removing the little bone specks. Now you have to remember that this is magnified about 10 times. So now this is an instrument. It's a spinning burr with water to prevent damage to the bone, and we use this for the final gross contouring of the osteoma. And you can see the irrigation in the burr. And then finally, once that is pretty smooth, we use a rasp, which is a diamond file, similar to your nail file at home. And this helps do our final smoothing so the patient basically can't feel this at all. Here's the osteoma after we have reduced it. And although it looks like you can see a little bit of it still, remember this is a very, very magnified situation and the patient can't feel that. So here are the bigger pieces that we removed here of this osteoma. And finally, here is the before and after picture taken 2 days later. So here we are, 24 hours, 48 hours after osteoma removal, probably one of the bigger ones that I have seen or will ever do. And I'm so honored that the patient came from Florida to Virginia to have this done. How do you feel?
Great.
How were our last 2 days?
A little sore, but overall, wonderful.
Good. You glad to get that off?
Oh, yeah, absolutely.
Okay. So what did you feel like after surgery? How was your recovery?
I was a little tired, but for the most part, it was well.
Great, great. So if we can zoom in here just a little bit, you remember in the preoperative interview there, he had this really large osteoma right here. It was about half the size of a ping pong ball. And put your chin down. Bend your head forwards a little bit. Can you just like bend your head? So this is I don't know if you were able to see, that was a single incision right there hidden in his hairline. And we did it, put your head back, we were able to do it all endoscopically. So his osteoma is gone. Now he is swollen here, which of course you would expect 2 days after surgery, but he doesn't have that big knob. It's going to make wearing his Harley-Davidson helmet easier.
Oh, yeah.
And when people talk to him, they're not going to stare at that knot on his head. Listen, it was really my honor being your surgeon. And if anybody's thinking about having an osteoma removed, what would you tell them?
Definitely come here.
All right. Well, I appreciate that. And this is such a great part of my job is meeting people from all over the country and helping them out. I'm Dr. Joe Niamtu, LoveThatFace.com.